Community analysis by Alexis Ruiz. For many years, Safety Harbor has been known as the special place in Florida where the healing waters flow. In 1539, Spanish explorer Hernando de Soto reached the shores of Tampa Bay and discovered the natural springs. It was during this time when he believed that he had found the fountain of youth. He named this fountain the Espiritu Santo Springs, or Springs of the Holy Spirit. In 1900, Safety Harbor became known as the health-giving city, with 5 springs that were believed to heal the sick. The Beauty Spring was believed to cure skin problems and provide cosmetic benefit. The Stomach Spring was believed to have a sweet taste, and parents used it over their children's cereal with the belief that it would cure general health problems, if any. The Kidney and Liver Springs cured kidney disorders and liver ailments, while the water from the pure springs was bottled up and sold for profit. Since then, Safety Harbor has become a favorite place to visit for many all around the world. Today, people still visit the Safety Harbor Resort to bathe, swim, and drink the water that is still believed and known to promote good health. The first inhabitants of Safety Harbor were the Timuacan Indians, who referred to what is today known as Safety Harbor as Tocobaga. It wasn't until 1917 when Safety Harbor was incorporated as a city with a population of 200 people. Today, 16,251 call this city home. Safety Harbor is located in Pinellas County at latitude 27.9909, longitude -82.6932, and an elevation of 20 feet. The city of Safety Harbor surrounds a land area of 4.92 square miles and a water area of 0.17 square miles. It is also in the eastern time zone of the world. The population density is 3,485 people per square mile and grows by 0.34% each year. In the city of Safety Harbor, there is 1 elementary school and 1 middle school. Safety Harbor Elementary is a Title I school located on 535 5th Street North. This school enrolls children from pre-kindergarten to 5th grade annually starting in the month of August. There are currently a total of 681 children attending and 43 teachers employed at Safety Harbor Elementary. Safety Harbor Middle School, on the other hand, is also part of Pinellas County School District. It is located on 901 First Avenue North and accepts students between the grades of 6 through 8 between the months of July and August. There are currently 1,392 students enrolled with a total of 74 teachers employed as educators. Moving on to the museum, there is a Museum of Culture Center in Safety Harbor. This museum displays art that dates back to prehistoric times. Some examples include Tocobagan Indians, Florida during the Civil War, and hardships of being a soldier. The museum also provides guided tours for those who are interested. Last but not least is Maddie Williams Neighborhood Family Center. This is an establishment that serves the people in Safety Harbor area as well as those living in surrounding areas. They aim to strengthen families and children using programs that promote and improve physical, mental, and moral development. The low-income housing in the city of Safety Harbor is limited. There are often times where income-based apartments are available in the city, but not very frequently. These types of residencies are most often made available to the elderly, disabled, and/or needy families with children. The monthly amount of these occupancies are based on total household income. The median household in the city of Safety Harbor is 57,597. Persons per unit total 7,212, while persons per household total 2.32. The percentage of people living in this community with little or no education is 8.9%. This amount excludes underage children who have not yet started school, as well as those who are currently being homeschooled. Safety Harbor is filled with community resources for both children and adults. Based on my findings in my community assessment, I found that the parks, trails, and centers that are available to the public are satisfactory in both quality and quantity. They are adequate and serve a purpose. An example of this would be the art park that is located in downtown Safety Harbor. This park consists of painted murals that help to introduce the younger population to nature. Moving on to the police department in the community. This police department, employed by Pinellas County through an annual contract, they strive to provide a safe environment for those living in the city of Safety Harbor. They employ 30 full-time firefighters as well as 400 police officers who work an average of 40 hours per week. The goal of this department is to protect the lives and property of all residents living in the Safety Harbor area. The most common call made to the fire department in the last 6 months was medical calls, which totaled approximately 2,152 calls. Some areas of concern that exist in the Safety Harbor area include lack of security and growing population. This city is one that does not employ any private security companies. This is an area of concern considering the amount of tourists who visit per year. It is also something to consider when events are being hosted and are open to the public and surrounding communities. Growing population is a concern for all communities. As the population grows, space and occupancy decrease, eventually leaving a community in crisis. Safety Harbor is a small community, and public officials, if not already, should have a plan to tackle an overpopulated community. Mease Countryside Hospital is an award-winning facility that serves all populations living in the community. The establishment consists of 300 beds and offers services that include but are not limited to women and children, heart, cancer, neurosciences, and orthopedics. Second in line is the Consulate Healthcare, which is a skilled nursing care facility that provides both assisted independent living services as well as independent services for caregivers or healthcare providers who are currently assisting the elderly. Last but not least is the Kimberly Home Pregnancy Resource Center that is amazing and also available to women. They assist families in unplanned and or high-risk pregnancies. The City of Safety Harbor uses the commissioner-manager form of government. The government and the city strive to maintain the community appearance. They also prioritize safety, particularly public safety for both those residing in the community and those visiting. Based on the findings in my community assessment, substance abuse and heart disease are the biggest issues in this community. Factors that contribute to both problems are readily available, affordable, and easy to access. Downtown Safety Harbor employs tons of fast food restaurants that can potentially contribute to this problem. The most common diseases that seem to be most prevalent in the Safety Harbor community are hepatitis B and C. I found that IV drug use is common in both Safety Harbor and surrounding communities. Based on the surveillance report conducted in Pinellas County by the Centers of Disease Control and Prevention, a total of 175 cases of hepatitis B and 239 cases of hepatitis C have been reported in the last year for both Safety Harbor and Clearwater. This is a huge health issue and brings us to the conclusion that drug counseling and rehab programs are definitely a need in this community. Based on the findings in the community, there are 3 specific community objectives that are applicable to the health of my community, and as you can see on my slide, they are listed. It is vital that community makes an effort to educate high school students on the importance of reporting such behaviors early. Early detection helps to prevent future issues. This is especially true also for adults using illicit drugs for a maximum of 30 days. Second is reducing the proportion of adults with hypertension. Educating the population on ways to control and or prevent high blood pressure can ultimately prevent heart disease. And last but not least, we have hepatitis. It's a global and community issue. It affects people worldwide, killing about 1.4 million people every year. People all around the world are providing vaccines, educating, and programs to help prevent and control this infectious disease. The City of Safety Harbor is currently doing the same, but the problem is still increasing and the death toll is rising. In this situation, a community nurse could intervene by hosting several community meetings to educate those in the community who maybe lack health insurance and or transportation. Although there are currently other things that are being done to combat this problem, education is truly the only key to compliance. And this, thank you very much,